How do you treat a cold? Do you always give antibiotics? Do you not give antibiotics? And what about all the fun stuff that you get over the counter?
You treat a cold. The treatment for a cold is supportive. There's no cure for the cold, and it just takes time. Your body has to fight off the viral infection, and there's no medicine. Antibiotics don't work on colds.
Okay.
So you should never treat a cold with an antibiotic.
Okay.
So that's number one rule.
Okay.
Colds do not get better.
Listen to that, parents.
Yeah, colds do not get better with antibiotics. Never.
Okay.
And in fact, can be harmful in certain cases. So if it is just a cold and there's nothing other complicating factors, then you should never treat it with antibiotics.
Okay.
It takes time. And I think this is probably the most important thing for parents and adults to know is that colds take time. And it takes usually about 7 to 10 days to get over a cold.
7 to 10 days?
Yes, 7 to 10 days is the average course of a cold, with usually the first 3 or 4 days tending to be the worst and the most contagious part of the illness. But it takes time. So you shouldn't expect to be better in 2 or 3 days.
Oh my!
And it doesn't mean that if you're not better in 3 days that you need antibiotics either.
You're just throwing all my misconceptions out the window. 7 to 10 days. Okay. So no antibiotics. Then what do you do? I mean, it's just symptomatic treatment?
Symptomatic treatment. Okay. So you can do things like saline spray or saline washes. Some people like using neti pot and things like that.
I've never seen a child sit still for a neti pot.
Yeah, for a child they won't do that, but we use saline spray.
Okay.
Saline spray for older kids or saline drops for infants. And that's actually, for infants, the main treatment is suctioning with saline. So the blue bulb suction that you use for babies, we use saline in their noses to help break up the mucus and then suction it out. So that's the primary treatment for an infant.
Because they don't know how to blow their noses.
Right, to help get it out, to clear the secretions for them.
Okay.
And you can do it in an older child too, if they'll let you use a bulb suction in their nose, or if they can blow their nose, they can blow their nose, but you can do some saline there. If they're having body aches or things like that, you can use ibuprofen or Tylenol, or if they're having throat pain or headaches, those kind of things will help. There are a lot of over-the-counter things, yes, all kinds of things, which you can use in older kids, like teenagers, and adults can use them. We don't use them very much in little ones because, one, a lot of them are not approved, or the FDA doesn't recommend using them in kids less than 4, and there hasn't been much proven benefit in kids for a lot of those things. And there's a high risk for having side effects and potentially overdosing, which is the reason why the FDA came up with some of these rules as far as the age that they're allowing over-the-counter medicines to be given to kids.
But you get them, I mean, they're just sitting there on the shelves, all the Sudafeds and the...
There's a lot of them. And
Vicks and...
Yeah, so most of them say less than 4 to ask a doctor. And that's relatively recent, where they came up with these recommendations.
Okay.
There are a lot of them. And, some of them, I do use them from time to time in older kids. And there's prescription ones that I use even in kids as young as 2 and even younger than that. But I use them on a case-by-case basis.
Okay.
Depending on what kind of symptoms they're having, and making sure that the parents are using it in a proper dose. And, sometimes I'll recommend over-the-counter cold medicines, particular ones also for a child, depending on their age and depending on what their symptoms are like.
Okay.
But in general, I wouldn't, just take tons of different medicines and try a bunch of different ones because they're not working. And because, like I said, it just takes time.
It's going to run its course.
Yeah, it has to run its course, and, usually takes about a week or so. So if you're not seeing an improvement, if you are using a particular medicine, you're not seeing an improvement, then I would just stop it.
Okay, good.